Hello, everybody. My name is Dr. Greg Polin, and I'm the director of the Mayo Clinic's Vaccine Research Group. Welcome to this podcast episode entitled Vaccinating Your Kids Against COVID-19. This is part of the 6-episode podcast series, What to Know About COVID-19, the Flu, and RSV. You're in for a treat today because I'm speaking with Dr. Todd Wolin. Dr. Wolin, can you tell us a little bit about yourself and the work you do with children and parents?
Sure. Thanks for having me. My name is Dr. Todd Wolin, and I'm a general pediatrician. I'm also CEO of Kids Plus Pediatrics right here in Pittsburgh, Pennsylvania. And through my work, I do talk to patients and their families face to face as well as online and work to educate them about how to keep their children healthy, how to recover when their kids get sick, but most importantly, whenever possible, on how to prevent illnesses.
That's great. And Todd, we're really pleased to have you today. I think our listeners already realize why I said it was a treat, because Dr. Wolin has the knack of taking complex information about vaccines and making it accessible to his patients and to their families. So, Todd, let's talk a bit about just what COVID-19 is.
Sure. Well, COVID-19 is a respiratory viral infection. That means it's an infection caused by a virus. In this case, a type of virus called coronavirus that starts in your respiratory tract. So this would be things like your nose, sinuses, throat, airways, and lungs. And while COVID-19 can start there, as we've seen, the virus can go on to cause damage to many different organs and systems throughout the body.
So true. I mean, we've been hearing so much about respiratory viruses, Todd, because of COVID-19 and the pandemic and what the media is calling the tridemic. But just to recap for our listeners, it's helpful to know that viruses are infectious organisms that don't have what they need to duplicate or replicate or make more virus on their own. So they have to attach to and enter or infect the cell of a host like us, and then use our own cells in order to duplicate themselves. And oftentimes, the virus in that process severely damages or even kills that host cell during this infection process. So that's what we see happen sometimes throughout the body with COVID-19, and it can affect so many different parts of the body. So, Dr. Wolin, maybe talk a bit about who can get COVID-19?
Sure. Well, it's important to know that anyone can get COVID-19 at any age. We've had thousands of kids in our practice and their family members test positive. It's mainly spread through the air when someone who's infected talks, coughs, sneezes, or even sings. Now, many people, once they become infected, can have no symptoms at all, or just mild illness, and can recover at home in just a few days or weeks. But it's important to know that for some people, COVID-19 can be severe and even deadly. And this can include both children and adults who have certain health conditions, as well as older adults and people who are pregnant or smoke. Health conditions that can put children and adults at higher risk for severe illness from COVID-19 can include a range of diseases and illnesses. And some of these include obesity or being overweight, asthma, and certain chronic or long-term lung conditions, type 1 or type 2 diabetes, certain heart conditions, chronic kidney or liver disease, sickle cell disease, cancer, Down syndrome, or just having a weakened immune system. But these are not all the conditions. So you should talk to your doctor in advance to see if you or your child might be at high risk of severe disease or severe illness.
Yeah, exactly. And, these symptoms of COVID-19 overlap with the symptoms for many other respiratory viral infections, including influenza, or what we often call the flu. And for the most part, these two infections are indistinguishable as far as their symptoms go. So you can't really use symptoms to determine which infection you or your child might have. So when you do have symptoms that are in the upper respiratory, tract, the mouth, the nose, you're going to want to contact your doctor or your healthcare team members as quickly as possible. And the reason for that is that there's testing that can be done to find out which virus, or sometimes people are co-infected with more than one virus, what's causing the illness. And knowing that is important because there are treatments available and they're different depending on which virus is causing the illness and symptoms. Also, we do want to make sure that we're taking steps to protect ourselves and our other children because there can be severe effects from COVID-19 and long-term effects even for kids. So, Dr. Woolen, maybe talk a bit to that point.
Sure. So, as we said, the virus that causes COVID-19 can damage many different organs and body systems. So, anyone at any age can have complications and symptoms from COVID-19 that may be long lasting. Some people, mostly children, can have a health condition called multi-system inflammatory syndrome, or MIS, during or after COVID-19. And this can be whether the illness was mild or severe. MIS causes inflammation or swelling of many different organs and can result in long-lasting health conditions and symptoms such as rash, fever, bloodshot eyes, vomiting, diarrhea, coughing, and a range of other symptoms. And then there's also post-COVID conditions, or what we're calling long COVID, that anyone can develop regardless of their age. This is a wide range of new, returning, or ongoing health problems that you can have for weeks, months, or even longer after first being infected with the virus. They do tend to happen more often if you had a severe illness from COVID-19, but anyone who gets infected with this virus can have them. This includes even people who only had a mild illness or no symptoms at all, as well as people who didn't even test positive or know they were infected in the first place. But unlike testing for a current infection with the virus, there's no test to check for long COVID, which can make it difficult to diagnose. And what can make things even more difficult, especially with children, is that they can't necessarily tell you about how they're feeling or if they're having symptoms. It even gets trickier when you're trying to compare how they were feeling a few days ago or a week or two ago. So trying to determine if they have symptoms now and or long-lasting symptoms can be tough.
So when we put it all together, it really drives home the point that doing everything you can to keep yourself and those around you protected is going to be key. We want to try to keep people from getting sick in the first place and missing school and work, and from getting sick enough to have to go to the hospital. Because if you get that sick, first of all, you're endangering your health. Secondly, during this respiratory season, there might not be space or staff at the hospital to take care of you properly. And thirdly, there are a lot of other viruses and even bacteria going around in the hospital. So you want to stay away from that unless it's absolutely necessary to protect yourself from other infections. But there are ways to help stay protected. And we have vaccines available for COVID-19 to help try to prevent infection or more severe illness. So, Dr. Woolen, can you talk a bit about how vaccines work along with your immune system to help protect you?
Sure. So vaccines for COVID-19 work together with your immune system, which is your body's natural defense system. Once given, the vaccine will trigger your immune system to make special Y-shaped proteins called antibodies. These are released into your bloodstream to help fight off a future infection. It can take several days or weeks for antibodies to develop, but once they do, they stay in your system and can recognize and help defend against the virus if you're exposed to it later. This is how you help build immunity or protection against future infection without actually having to get the infection or the disease first. We call this vaccination immunity. And getting the vaccine is way safer to help build immunity rather than getting the actual disease itself, or what we call infection immunity. Because even if someone is young and healthy, you run the risk of severe illness and complications from a COVID-19 infection. There's no way to tell in advance how someone, including children, will react to getting infected by the virus, or be affected by COVID-19. As we've seen, even children can get serious complications and long COVID. So we still aren't sure what infection can mean for you or your child's health in the long run.
That's so true, Todd. And here's where the balance of risks and benefits of getting your child vaccinated against COVID-19 comes into play. Because as we've seen, people, including children, are getting sick from COVID and are having long lasting health problems. But the vaccines are effective at preventing infection, serious illness, and death from COVID-19, and they've been shown to be safe. Also, it's important to know that you can't get COVID-19 from the vaccine itself because it doesn't actually contain the live virus that causes COVID-19. In fact, the vaccines that are allowed for use in the US are studied and reviewed by the US Food and Drug Administration, what you hear called the FDA, which is the US agency that makes sure medicines and vaccines are safe and effective, as well as outside review by other experts. So before recommending COVID-19 vaccination for children, and right now the primary series is for everyone who's 6 months and older, the FDA determined that the vaccines were generally safe and effective in this age group, and that the known risks of COVID-19 and possible severe complications that Dr. Wolin has been talking about outweigh the potential risks of a rare adverse reaction or side effect from the vaccine. But all medicines can have side effects, including vaccines. So, Dr. Wolin, what would you tell parents who may have a concern?
Well, what I would tell them is that's true that all medicines can have side effects, but the benefits of getting the vaccine and reducing the risk of how sick COVID could make your child far outweigh any side effects that could happen. We've given in our own practice greater than 10,000 COVID vaccinations to kids ages 6 months all the way through 21, and have not even had one single kid come back in for a recheck with anything related to the COVID vaccinations. So far, the best protection right now is COVID-19 vaccinations that are recommended for everyone 6 months of age or older. And right now, boosters for everyone 5 years of age or older, if they're eligible. Because protection from the COVID-19 vaccine can start to weaken after a few months. So getting COVID-19 vaccine booster is also important. And this is the case for many different vaccines, for many different diseases. A booster is needed to help stay protected. But if you're up to date on your COVID-19 vaccine series and booster, you will likely have stronger protection against COVID-19, including its variants too. But before vaccination, you're going to want to tell your child's doctor and the person giving your child the shot about any allergies your child may have. And this is the same for when your child gets their routine vaccines or any vaccine at all. COVID-19 vaccinations can help prevent your child from getting seriously sick if they do end up getting COVID-19 infection. Because while children with other health conditions are at higher risk for severe illness from COVID-19, even healthy children without any conditions can have severe illness.
This is really good information to know, Todd, so thank you. And it's also important to point out that getting the vaccine helps lower the spread of COVID-19, which then helps protect all of us and decreases the risk of further viral mutations. And while severe illness from COVID-19 and post-COVID conditions like long COVID happen less often in children and teens than in adults, anyone can have long-lasting symptoms and complications regardless of their age, and you don't get to choose. So talk to your child's doctor about getting them vaccinated and any boosters that might be recommended. Doing as much as you can to help protect yourself and others against the infection is the best way to help us all stay healthy. And this includes getting vaccinated, getting tested if you have symptoms, taking precautions such as isolating if you're sick, and wearing a proper mask properly. Well, Dr. Wolin, this has been a great discussion. Thank you so much for joining me today. Any closing thoughts you have for our listeners?
First off, again, thanks for having me on. And as I tell my families, the kids and the parents, the best thing we can do is to prevent infections. Vaccines are a great way to do that. And there is a lot of mis and disinformation out there. So please talk to your healthcare provider about what's best for your kids.
Thanks so much. And thanks to our listeners. Todd, that last point is really key. Get expert information. Don't make decisions based on what a celebrity or a sports star says. Don't make decisions out of fear. Make them on wise advice. So thank you.
Absolutely. Thank you.